So for our young lady here, we do Xeomin, actually not Botox, Xeomin for 3 main areas. We're gonna do the 11, so we're gonna go a little deep. This is for the procerus, and I go to the origination side, and then all the way deep, and then when we go to the corrugator, a little bit at an angle, and I keep injecting the way up for the levator supercilia muscle as well. Do the same thing here. Okay, and then for the tail of the corrugator, I'm very superficial here. Okay, so that we do not go into the supraorbital foramen. Don't go any eyelid problems. Okay, and then big smile. Okay, you can relax. You can see she has here and here. So what we're gonna do 10, but I'll do 4 units here, and then another 4 units in this area, and then in between I'm going to do 2 units. So I modify a little bit depending where we need to do what we need to do. I'm going to do a lip flip as well, and she loves this treatment. So for here, I'm going to do a little pinch, and then another one here. Okay. So we're going to do the other side of lip flip and then the crow's feet in a second. So what we're going to do, continue with the forehead, frontalis muscle. So already know her muscle, we injected it before, but lift your eyebrows up, up, up. Okay, and it's good. Most of them are in the middle and high, so she's easy injection, because she doesn't have much lines low and she doesn't have them on the side. When a patient has a lot of line here just above the eyebrows, they're the tricky ones, because if you're gonna fix these lines, you're gonna compromise, and then it's gonna create some pressure on the eyebrows. Here are really nice and high, so that's easy, my friend. Okay, so I injected 2, 2, 2, 2, 2, 2, and then 1, 1 on the side, so that's a total of 14. But we do this because the side like to do that area, otherwise the muscles here will spark, and then the eyebrows on the side would be like this. Doesn't look natural, so that's why I like to inject a little bit there as well. We're almost done. Miss Petey here.
Short.
Yeah, but
But I didn't want to touch the wall, so I was like, okay, you can do that.
So she's saying that we're always, when we draw the Xeomin or Botox, any of these medications, it's very important not to touch the wall of the vial, because that will blunt the needle, and then it will make it a little bit more unpleasant for the patient to inject them with a dull needle. So another 4. Just do also continuation of the lip flip at the vermilion border. We're almost done. Usually that's the most sensitive area for the injection, but we're done with that area, so everything is going to be easier. Big smile again, squint. Okay, so you see here is different, so still we're going to match the other side, but actually it doesn't have much in this area. Okay, and remember here we didn't inject. Let's do the forehead, and that's it. We're done. We made it.